More than 850 million people around the world are currently living with some form of kidney disease. That is more than diabetes, more than cancer, more than heart failure, and yet most of them do not know it yet. In the United States alone, more than 35 million adults are living with chronic kidney disease right now, and roughly 9 out of every 10 of them have no idea their kidneys are already damaged. Not because the disease is rare, because it is silent. It does not announce itself with pain. It does not interrupt your day. It simply progresses, stage by stage, while everything on the surface looks normal. There are 5 clinically defined stages of chronic kidney disease. Every case moves through this same framework, measured by how efficiently your kidneys filter waste from your blood. Some people move through these stages over decades. Others move through them in a matter of years. But the direction, without intervention, is always the same. And understanding exactly which stage a person is in changes everything. How urgently they need to act, what damage can still be reversed, and what window is still open before the damage becomes permanent. We are going through all 5 stages today. What is happening inside the kidneys at each stage, what the person is experiencing, often without realizing it, what the numbers on a routine blood test actually mean, and what each stage means for the decisions that matter most right now. There are also things that can be done today, regardless of which stage concerns you, that the medical research says make a measurable, meaningful difference. We will reach those at the end. Subscribe now if you want your health explained clearly, sourced from established medical guidelines, and delivered without exaggeration. This is Wellness Daily, and helping you reach the people who need this most is exactly what we are here to do. Let us start at Stage 1. Stage 1. Normal kidney function, with a warning sign. Stage 1 is the stage almost nobody believes applies to them, because in Stage 1, kidney function itself is completely normal, or even above normal. Your glomerular filtration rate, the number doctors use to measure how well your kidneys clean your blood, known as GFR, sits at 90 or higher in Stage 1. That is a normal, healthy number. If you saw it on a lab report with nothing else attached, you would have no reason for concern. And yet Stage 1 chronic kidney disease is real disease. The filtration rate is normal, but there is already measurable damage to the structure of the kidney itself. This is usually detected through a urine test, not a blood test, specifically a test for albumin, a protein that should stay in your bloodstream and not leak into your urine. When it appears there, even in small amounts, it is one of the earliest signals that the kidney's filtering units, called nephrons, are beginning to sustain damage. This is the stage that is almost always missed. Not because doctors are careless, but because a routine physical typically checks blood pressure, cholesterol, and blood sugar. It does not automatically check urine albumin unless a patient has a specific risk factor already flagged, most commonly diabetes, high blood pressure, or a family history of kidney disease. If you do not fall into one of those categories on paper, this test is often never ordered at all. Stage 1 can persist for years, sometimes decades, without a single symptom. No fatigue, no swelling, no change in urination. The kidneys are resilient organs, built with far more filtering capacity than the body needs day to day, and they compensate quietly for a long time. For yourself, if you have diabetes, high blood pressure, a family history of kidney disease, or are simply over the age of 60, Stage 1 is the stage where a single urine albumin test, combined with a blood test for GFR, can catch this years before it becomes anything more serious. Ask your doctor directly for a urine albumin to creatinine ratio test. It is inexpensive, it is fast, and it is very often not ordered unless you ask. For a loved one, if someone close to you has diabetes or high blood pressure and has never had their kidney function specifically screened, this is worth raising directly. Stage 1 is completely invisible from the outside. There is nothing to notice yet. The only way to catch it is to test for it deliberately. There is also a genetic and demographic reality worth naming plainly. Certain populations carry a significantly higher lifetime risk of developing chronic kidney disease, including people of African, South Asian, and Hispanic descent, independent of lifestyle factors alone. This does not mean disease is inevitable. it means screening matters even more. And it means stage 1, for these populations especially, is a stage worth actively looking for rather than waiting to stumble upon by accident. Stage 1 is the disease hiding behind a normal-looking lab report. Stage 2 is where the numbers begin to move, even while the person still feels nothing at all. Stage 2, mild loss, still silent. In stage 2, GFR drops into the range of 60 to 89. Kidney function has declined mildly, alongside the same structural damage markers present in stage 1, most commonly that same leak of albumin into the urine. This is still, in the vast majority of cases, a completely symptom-free stage. This is where stage 2 becomes genuinely dangerous from a public health standpoint. A GFR in the high 60s or 70s can be partly explained by normal aging. Kidney function naturally declines somewhat as people get older, even without disease. This makes stage 2 easy to dismiss, both by patients and, at times, by clinicians who are not tracking the trend over time. A single number in isolation can look unremarkable. It is the trend, tested repeatedly over months and years, that reveals the truth. The kidneys in stage 2 are still doing the vast majority of their job. Waste is still being filtered. Fluid balance is still being managed. Blood pressure regulation, a critical and often overlooked kidney function, is still largely intact. This is precisely why nothing feels different yet. What is happening structurally, however, is not nothing. The nephrons, the microscopic filtering units inside each kidney, do not regenerate once they are lost. Each kidney contains roughly 1 million of them, built with enormous redundancy. Losing some in stage 2 does not yet produce noticeable symptoms, because the remaining nephrons increase their individual workload to compensate. That compensation is a quiet, ongoing biological effort happening every single day. For yourself, if you are in stage 2, this is the stage with the greatest opportunity to change your trajectory entirely. Blood pressure control, blood sugar management if you have diabetes or prediabetes, and specific dietary adjustments have their greatest protective effect right now, while the majority of kidney function is still intact. We will return to exactly what the research supports at the end of this video. For a loved one, if someone in your life has been told their kidney function is a little low for their age, and the conversation ended there, it is worth asking their doctor a more specific question. What stage is this, and what is the plan to prevent it from progressing? A vague reassurance is not the same as an actual management plan. It is worth understanding why this compensation is a double-edged process. When remaining nephrons take on extra workload, they experience increased internal pressure over time, called hyperfiltration. In the short term, this preserves overall kidney function beautifully. Over years, however, that same extra pressure can gradually damage the very nephrons doing the compensating, contributing to further decline down the line. This is part of why early intervention in stage 2 matters so much. It is not simply about slowing today's decline, it is about protecting the compensating structures from being worn down by their own extra effort. Stage 2 is quiet erosion, measurable but unfelt. Stage 3 is where the body itself begins to notice, even if the person does not yet connect the dots. Stage 3. The stage where symptoms begin, and dismissal begins with them. Stage 3 is typically divided into 2 parts by kidney specialists, called nephrologists. Stage 3A covers a GFR of 45 to 59. Stage 3B covers a GFR of 30 to 44. By the time someone reaches stage 3, roughly half or more of normal kidney function has been lost. And this is the stage where symptoms, for the first time, can genuinely begin to appear, though they are frequently mistaken for something else entirely. Fatigue that does not resolve with rest, swelling in the ankles, feet, or hands, caused by the kidney's declining ability to manage fluid balance. Changes in urination, more frequent at night, or foamy in appearance due to protein leaking into the urine in larger amounts. Difficulty concentrating, sometimes described as mental fog. Muscle cramping, particularly at night. Dry, itchy skin, caused by a buildup of waste products the kidneys are no longer clearing efficiently. Here is the problem. Every single one of these symptoms overlaps almost perfectly with normal aging, poor sleep, stress, or simply being busy and run down. A person experiencing stage 3 symptoms rarely thinks kidneys. They think they need more sleep, more water, less stress, or a vitamin. Their doctor, without a recent kidney function test on file, may reasonably explore several other explanations first. Meanwhile, inside the kidneys, real structural change is occurring. Scarring, called fibrosis, is beginning to replace healthy filtering tissue in measurable amounts. Blood pressure often becomes harder to control because the kidneys play a direct role in regulating it, and a kidney that is struggling contributes to the very problem that is damaging it further. This creates a feedback loop that, left unaddressed, accelerates the decline rather than merely continuing it at a steady pace. Stage 3 is also the stage where other organ systems begin to feel the downstream effects. The kidneys help activate vitamin D and help produce a hormone called erythropoietin, which signals the bone marrow to produce red blood cells. As kidney function declines through stage 3, both processes can become impaired, contributing to bone health issues and, eventually, anemia. For yourself, if you recognize a pattern here, not one isolated symptom, but several occurring together and persisting for weeks rather than days, ask your doctor for a full kidney function panel, GFR, urine albumin, and a basic metabolic panel to check electrolyte balance. Ask specifically whether a referral to a nephrologist is appropriate at this stage. In many healthcare systems, that referral does not happen automatically until stage 4, even though stage 3, particularly 3B, is exactly when specialist input has the greatest opportunity to slow progression. For a loved one, if someone close to you has been unusually tired, has new swelling in their legs, or has mentioned their urine looking different, do not let this get filed under getting older. Encourage a specific conversation with their doctor and offer to go with them. A second person in the room often catches details and asks follow-up questions the patient, focused on simply getting through the appointment, does not think to raise. Stage 3 still often looks, from the outside, like an ordinary tired week. Stage 4 does not allow that explanation any longer. Stage 4, severe loss, and the stage of serious planning. Stage 4 covers a GFR of 15 to 29. By this point, 70 to 85% of kidney function has typically been lost. This is the stage where symptoms become difficult to explain away and where the conversation with a healthcare team shifts in tone, from monitoring to active, structured planning. Fatigue in stage 4 is often profound, not the tiredness of a long week, but a persistent depletion that rest does not resolve. This happens partly because of the anemia that frequently develops as kidney function declines further, and partly because of the buildup of waste products in the bloodstream that the kidneys can no longer adequately clear, a condition broadly referred to as uremia. Swelling becomes more pronounced and more difficult to manage through diet alone. Appetite frequently decreases, and some people describe a persistent metallic taste caused by the same waste product buildup affecting the nervous system and taste perception. Nausea can become a regular occurrence rather than an occasional one. Shortness of breath may develop, sometimes due to fluid accumulating around the lungs, sometimes due to the anemia reducing the blood's capacity to carry oxygen efficiently. Sleep disturbances, including a condition called restless legs, become more common as toxin buildup affects the nervous system. This is also the stage where blood test results begin to show clear, unmistakable abnormalities beyond GFR alone. Phosphorus levels frequently rise because the kidneys can no longer excrete it efficiently, which in turn affects calcium balance and bone health. Potassium levels can become dangerously elevated, which is a direct cardiac risk, since potassium plays a central role in regulating heart rhythm. This is one of the most medically serious aspects of stage 4 kidney disease, and it is precisely why regular blood monitoring becomes non-negotiable at this point. Stage 4 is the stage where the conversation about what comes next needs to happen, clearly and without avoidance. Not every person in stage 4 will progress to stage 5, particularly if underlying causes like blood pressure and blood sugar are brought under tighter control. But planning needs to begin now, while decisions can be made calmly rather than during a medical emergency. That planning includes a direct, specific conversation about dialysis, the medical process that filters waste from the blood when the kidneys can no longer do it adequately themselves, and about kidney transplantation, including whether the person is a viable candidate and whether family members or others wish to be evaluated as potential living donors. It also includes dietary changes that typically become significantly more structured at this stage, often guided by a renal dietitian, involving careful management of protein, potassium, phosphorus, and sodium intake. For yourself, if you have received a stage 4 diagnosis, the most valuable thing you can do right now is engage fully with a nephrology team, not just a general practitioner. Ask specifically about a referral to a renal dietitian. Ask what your individual timeline projection looks like based on your rate of decline, and ask directly what dialysis access planning involves, because that groundwork, if dialysis does become necessary, is far better done in advance than during a crisis. For a loved one, this is the stage where being present at appointments, understanding medication changes, and having honest conversations about what the person wants going forward, medically and practically, matters enormously. These are not conversations to postpone. They are acts of care, offered while there is still time to have them thoughtfully. There is one more connection worth making explicit at this stage, because it surprises many people. Chronic kidney disease and heart disease share the same damaged blood vessels, and by stage 4, cardiovascular risk rises sharply alongside kidney decline. A person in stage 4 kidney disease is, statistically, considerably more likely to experience a cardiac event than to ever reach dialysis. This is not meant to alarm, it is meant to explain why a stage 4 care plan almost always includes cardiovascular monitoring alongside kidney-specific treatment, and why medications like ACE inhibitors or ABs, which protect both the heart and the kidneys simultaneously, are so central to management at this stage. Stage 4 is difficult, but it is not without agency. Real decisions, made now, meaningfully shape what stage 5 looks like, if it is reached at all. Stage 5, kidney failure, and the stage of active management. Stage 5 is defined as a GFR below 15 and is also referred to as end-stage renal disease or kidney failure. At this point, the kidneys are no longer able to adequately perform the functions the body depends on to survive: filtering waste, balancing fluid and electrolytes, regulating blood pressure, and supporting red blood cell production. Without treatment, the buildup of waste and fluid in the body becomes life-threatening. It is important to be precise about what kidney failure means in this context, because the phrase sounds more final than the reality often is. Stage 5 does not mean the end of meaningful life. It means the kidneys need direct medical support to continue the job they can no longer do alone. That support comes in one of two forms: dialysis or kidney transplantation. Dialysis itself has two primary forms. Hemodialysis, typically performed at a dialysis center several times a week, uses a machine to filter the blood outside the body. Peritoneal dialysis, which can often be performed at home, uses the lining of the person's own abdomen as a natural filter, with fluid exchanges performed daily. Neither option is without significant lifestyle adjustment, and the choice between them is highly individual, based on health status, home support, work schedule, and personal preference. Kidney transplantation, when a suitable donor organ is available, whether from a living donor or a deceased donor, remains the treatment most likely to restore the closest thing to normal kidney function and quality of life. It is not available to everyone immediately, and it is not without its own risks and lifelong medication requirements. But for eligible candidates, it represents the most complete form of treatment currently available. Symptoms in untreated or undertreated stage 5 are severe: significant fatigue, confusion in advanced cases due to toxin buildup affecting brain function, difficulty breathing, dangerous shifts in heart rhythm from electrolyte imbalance, and a general decline that, without dialysis or transplantation, progresses toward organ failure. But here is what deserves to be said clearly. Many people live full, active years in stage 5 with consistent dialysis or after a successful transplant. This stage requires significant medical management and real lifestyle adaptation, but it is not, by itself, a stage without a future. What it requires is consistency, attending every dialysis session, following dietary guidance closely, taking medications exactly as prescribed, and staying closely connected with the nephrology care team. For yourself, if you are in stage 5, the most protective thing you can do is treat your care plan as non-negotiable, not as a set of suggestions to follow when convenient. Missed dialysis sessions and inconsistent adherence are among the most significant predictors of complications at this stage. Ask your care team directly about transplant evaluation, even if you assume you may not be a candidate. Many more people qualify than initially believe they do. For a loved one, stage 5 caregiving is demanding, logistically and emotionally. Understanding the treatment schedule, supporting dietary changes at home, and simply being present during dialysis sessions when possible make a measurable difference in how a person experiences this stage. If you are a potential living donor candidate, being evaluated is worth exploring even before it becomes urgent. It is also worth being honest about the waiting list reality for deceased donor transplants, which in many regions can stretch several years, precisely why living donor evaluation, when a willing and medically suitable candidate exists within a family or close circle, is so often raised early rather than late. A living donor transplant typically offers a shorter wait and, on average, better long-term outcomes than a deceased donor transplant, which is part of why nephrology teams raise the option proactively rather than waiting for a person to ask. You have now walked through all 5 stages of chronic kidney disease, from a normal-looking lab report hiding early damage to full kidney failure requiring active medical support. What the research actually says you can do right now here is what matters most, no matter which stage concerns you today. Chronic kidney disease, according to major nephrology and public health research, is driven overwhelmingly by 2 conditions: diabetes and high blood pressure. Together, they account for the majority of all chronic kidney disease cases worldwide. This means that the single most protective thing most people can do is manage these 2 conditions consistently, not occasionally, not when convenient, but consistently, year after year. Blood pressure control specifically protects the small blood vessels inside the kidneys that make filtration possible in the first place. Even modest, sustained improvement in blood pressure control has been shown to slow the rate of kidney function decline meaningfully across large population studies. Blood sugar management for anyone with diabetes or prediabetes directly reduces the damage high glucose levels cause to those same delicate blood vessels over time. This is one of the most well-established relationships in all of kidney health research. Reducing sodium intake supports both blood pressure control and reduces the direct workload placed on the kidney's fluid balancing function. Staying adequately hydrated, without overhydrating, supports healthy kidney filtration. Avoiding regular, long-term overuse of over-the-counter pain relievers, specifically NSAIDs like ibuprofen, matters significantly, since these medications are processed through the kidneys and can contribute to damage with frequent, sustained use. And routine screening, that same urine albumin test and GFR blood test discussed at stage 1, remains the single most effective early detection tool available, and it is inexpensive and widely accessible. None of this requires a specialist referral to begin. It requires a conversation with your regular doctor and a willingness to ask for the specific tests by name. What to do after this video? If you are watching this for yourself, make an appointment this week. Ask specifically for a GFR blood test, a urine albumin to creatinine ratio test, and a direct conversation about your personal kidney disease risk factors. Ask for these by name. If you are watching this for someone you love, share this video with the people involved in their care. Understanding which stage a person is in changes how you support them, what conversations need to happen, and how much time there genuinely is to plan carefully rather than react in crisis. This has been Wellness Daily. One question in the comments before you go. Which stage made you stop? The one that made you think of yourself or of someone you love? Just the number. Stage 1 through stage 5. I read every comment, and the answers shape what comes next for this community.